All right, I'm going to do the cool mist humidity with a trach inserted. On this, before I go into the room, I'm going to gather the equipment, and I'm also going to check through the orders for the physician to see if I have them on the correct FiO2 and how long they want the therapy ran. Most of the time it's continuous, so if it is a continuous therapy, make sure you're changing out the tubing to prevent any infection. Again, I'm just going to grab all the equipment that I need. For this, you would need the trach mask, so that the mist can be delivered into their trach. You're going to need the corrugating tubing. You're going to need, I don't have it, but you will need the aerosol canister with some sterile water. And you're also going to need the bag for any condensation to make it run into the bag, and I'll kind of tell you about that as I go on. All right, I'll enter the room here. All right, hello, I'm Tyler. I'm a respiratory therapist here at the hospital. Today I'm going to set up some humidification. Since your airway's passed, you're not getting the same moisture and heat or coolness that you need. This will help kind of keep the secretions loose so they're not drying up and causing more complications. All right, so just kind of let me get all set up here. I'm going to wash my hands. I'm going to check and make sure it's the correct patient, and then I'm going to take a listen to their vitals. And this is essential to listen to their breath sounds, to get their SpO2, respirations, heart rate, and even maybe their blood pressure if that is a regulation of the hospital. So I'm going to grab all the vitals, and then after that I can kind of get prepared. So I'm going to go put on gloves to kind of keep this sterile. All right, so I got my gloves on. All right, and at first I don't have the aerosol canister, but this is where I'd hook it up to our flow meter. I'd turn the flow meter on before I hook it up to clear any dust particles out, make sure it's not confiscated, that the flow meter's weak, working. So after I put the sterile water into my aerosol canister, I'll hook that up, and then I'll grab my other equipment. So I got the trach mask. I'm going to put that on first. All right, I'm just going to put this around you here. That's just going to go on your trach. All right, and you just want to make sure this is fitted correctly, so the patient, they're getting the correct amount of FiO, or the correct percentage of air, and it's not, I guess, going out in the air. They're not actually getting the correct amount that they need. Also, with this setup, I got some corrugated tubing. This is going to actually connect to the aerosol canister itself, and then connect to the patient, this trach mask. All right. So I'm going to have connect this to the aerosol canister, and we're just going to imagine that since I don't have an aerosol canister. And then also in this line there is going to be the bag for the condensation in the water, to make sure this won't go into the trach. And when I set this up, I don't have enough corrugated tubing, but I need to set this up lower than the patient's trach, or lower than the patient's body, so it's draining into the bag and not, again, into the trach. And then it should connect straight on to the trach mask. And at this point, I need to actually make sure I test when it's on that 10 liters. I would have this before. Make sure the mist is actually, you see mist coming out, the particles, to make sure that it's the canister and the flow meter and all everything is pushing the mist. All right, so I know the mist is working here, and then I can connect it. All right. At this point, most of the times you're going to set it at 10 liters, kind of dependent on the FiO2 again. 10 liters is kind of the minimum to get the correct FiO2 and get the mist going. And there is calculations to get, say, an oxygen ratio. You take 100 minus the FiO2 divided by the FiO2 minus the room, the room oxygen level, which is 21%. That'll give you the ratio of, say, like 7:1 or whatever FiO2 you're working with. By that, you can calculate other factors such as total flow, and total flow would just be that oxygen ratio time, or oxygen ratio. So if you have 7:1, you take it 7, times 1 will give you 8, and then you times it by how many liters there are. So in this case, we'd be at 10, so you'd get like 80 liters per minute. When you're calculating total flow, it really comes into place what flow you want the patient on. Usually there's certain guidelines for the total flow of the patient, such as that is on a trach mask, to make sure they're getting the correct amount of oxygen again. All right, after everything's set up and making sure that bag's low enough, I can kind of clean up here a bit. And then I'm going to listen to the breath sounds again once this is going, making sure, their breath sounds haven't changed significantly, their SpO2 is still running good, and they're getting the correct oxygen. Their heart rate, making sure nothing's going on, because mist can cause some contradictions. Usually it's not very often, but they can, so you always got to be aware of maybe there's too much mist causing any spasms or anything. At this point, making sure the patient is back into the proper position, making sure again that the bag is low, that the trach is hooked up, that their call light's close, that if they would have a trach collar, that is tightened on and it doesn't look to be have any bacteria on it, making sure maybe the dressing needs to be changed. So after you kind of got the patient back in, the call light close, safety precautions, that is the bed is locked in the lowest position, or if they're in a chair. Then you can just kind of remember that you'll have to change the corrugated tubing. Usually most hospitals, I think, is once daily to prevent any infection. Make sure you're coming in to check every so often that the trach mass is not being displaced and that their stats are doing fine yet. That the sterile water, make sure that it doesn't need to be filled up again. You don't want it to run too low, or they won't be getting the correct humidification. And after that, you can kind of look at the patient when you're going to check on them again, make sure everything is good in the room, throw everything away where it needs to be. Then I can wash my hands and exit the room. At this time, after I exit the room, again, I'll record kind of the flow rate, the FiO2 that the patient is on, how everything sounded. So when the next time I come in, or if a new respiratory therapist come in, they know how everything was working after you left the room, to make sure nothing has changed. And that is it.